Introducing the S3 Proximal Humerus Plate from Hand Innovations. The S3 was designed to provide true spatial subchondral support. The proximal fixed angle locking pegs or screws and the distal 90-degree fixed angle or variable angle screws secure optimal anatomic restoration of the proximal humerus. With the patient in the supine or beach chair positions, plan for a delta pectoral incision. The incision begins at the coracoid process and proceeds distally along the bicep approximately 12 to 14 centimeters. Capture preoperative images to assess the severity of the fracture. Identify and retract the cephalic vein and the coracobrachialis. Then, identify and release the proximal third of the pectoralis to reveal the long head of the biceps. Elevate the deltoid, and if necessary, the deltoid insertion can be partially released. Care must be taken to protect the branches of the axillary nerve that lie under the deltoid. Please note that the proximal branch of the circumflex artery is often already ruptured. Debride the fracture by removing all fibrous tissue, callus and clot to allow for a full reduction. Reduce the fracture by traction and manipulation and visualize with fluoroscopy if necessary. The S3 plates are designed to closely match the patient's anatomy, making correct alignment simple and consistent. The straight anterior edge of the plate is aligned along the lateral ridge of the bicipital groove, and the plate is moved proximally to match the contour of the bone. The proximal aspect of the plate should stop approximately 2.5 centimeters distal of the supraspinatus. For initial positioning, place a cortical screw through the slotted distal hole. This will allow for simple plate repositioning if needed. The K-wire is drilled through the center hole on the proximal portion of the plate. Fluoroscopy should be used to verify the stability of the proximal fragment and to prove plate alignment. When the plate is correctly positioned, the fixed angle K-wire should cross along the center line of the humeral head. Prior to drilling, make sure that the reduction is maintained. The 4 mm short drill is used only to breach the lateral cortex of the humerus. The 4 mm long drill or the stepped drill are driven by hand and under fluoroscopic guidance and by hand for the pegs or the screws respectively. These drills are used to complete the drilling to the subchondral bone. Drill guides or fast guides are pre-assembled to the plate. Each will guide the drill in the precise fixed angle direction. The tip of the long drill has been designed to guard against penetrating the articulating surface. Once the drilling is complete, the smooth pegs or fully threaded screws can be sized by reading the scale at the top of the fast guide or by using the telescoping depth gauge. Once the screw length has been determined, the fast guide can be removed with the fast guide removal tool. Once all the pegs or screws have been locked into place, the remaining cortical screws are inserted. The plate can accommodate both 90-degree locking fixed angle cortical screws as well as non-locking cortical screws. Set screws are used with the 90-degree locking screws to ensure maximum screw stability. Heavy suture material is used to anchor the tuberosities to the proximal aspect of the plate. The first loop secures the lesser tuberosity. The supraspinatus is affixed with the central loop where the knot lies on top of the plate, and a third loop secures the infraspinatus. Once the plate is attached, a full range of motion is performed. You will notice that because of the distal positioning of the S3, the risk of subachromal impingement is greatly reduced. Utilizing fluoroscopic imaging confirmation, images can be acquired to record final implant placement. You can clearly see from these images how the distribution of the pegs or screws in the proximal fragment matches the surface of the humeral dome to provide optimal spatial subchondral support. Hand Innovations, dedicated to excellence in upper extremity fracture fixation, is raising expectations with the S3 Proximal Humerus Plating System.